Do you remember any of the reoccurring elements in some of these nightmares that Alli had?
I don't.
This niece,
Unless
Evelyn,
you give me a little more.
Yeah, like she had a dream about her oldest niece, Evelyn, drowning, dreaming of herself as a child in the third person, shaking, sexual assault, being surrounded by family. Any of these?
Well, one of the memories I do recall in her case was she did have memories of going out to for summer vacation by, I think this was at her house or property, was her, and she had very, very conflicting feelings about being there. For example, I remember her telling me she recalled a day when it was blue skies and it was a summer day, and where that would evoke in someone who's quote unquote normal a happy response. Her reality was that the blue skies and the summer feeling by the lake at house brought on terror, it brought on depression, and it brought on a terrible loneliness and feeling of fear. One of my clinical evidences comes from her personality, her overall personality. She's very bright. She's very creative. She has an eye for things. She has always been an observer. And I believe as a little child that if she did experience trauma, and I do believe she did, and we have some, I wouldn't call them suspects, but I would call people of interest as possible abusers, I would say that she was in a pre-verbal age, which means she was 2 to 3 years old. And she would go out to in those days as a little child, pre-verbal, but she observed and she saw everything that was going on. And I think they're the things that are locked in her memory. So when you see a patient shake and tremble and visibly shake before your eyes when you bring up a particular topic, that's not normal. The body is remembering, the body and the mind are remembering something that happened to it. And I can only imagine that someone who would feel something so strongly and not be able to say, that's where it's coming from, or that's the causation, that's the reality behind my feeling, must have been very, very highly anxiety provoking.